And hello, everyone. Hello from merry England. It is 6 o'clock here in the evening in England. You might be able to tell from my accent that I was not born here. I'm a regular old American guy going on Do Not Disturb so that I'm not bothered while I'm doing this. Um, but digital health has taken me all over the world. I did the math, and the number of times it's taken me around the world is 25. So it's been a great boon for me, but unfortunately, there's no place to actually go and get a degree in digital health, right? So that's why I do this. That's why I have a coaching service. I help other clinical people. Hey, Chester Bako. Wow, that's a pleasure. Good to see you, Chester. So I'm doing tonight's live is going to be on some exciting stuff that's been happening just in the last week. This week, my pre-made, pre-written blog entry for my website was on the great healthcare transformation and how AI is creating the future that we've always wanted. I couldn't have known when I wrote it the things that would be good. Thanks, Chester. I couldn't have known the things that would be coming out in the news during the same week, but everything has coincided. So. So for those of you who don't know me, I'm Rod, career coach Rod, and I help clinical professionals transition from clinical roles, traditional clinical roles, into digital health careers where they can have a massive amplified impact without the burnout that comes from, clinical roles. So tonight, I'm talking about the most significant healthcare transformation in human history. All of us, on the verge of the dawn of AI, right? And why this week proves that if you're thinking about making a career change, the train is literally about to leave the station. So drop something in the comments if you've been thinking about leaving bedside care, but you weren't sure about the training, you weren't sure about the timing, or you thought, I got to be a programmer, I got to be a computer expert, that sort of thing, because it's just not the case. So this week, we had a couple of major announcements. This week, we saw Oracle launch a completely new AI-first EHR. This AI-first EHR is voice-based, right? And Epic has announced over 160 new AI initiatives. So this is not future thinking. This is not stuff that's going to happen one day. This is now. I watched that Epic announcement on Tuesday, and I'll say Epic has a very strong culture. It was interesting to watch, very unlike other companies that I've seen. So I want to tell you, we're at the dawn of this AI era, right? Well, I was starting my career at the dawn of the computing era, at the dawn of the data era. We had no computers in any of the hospitals that I had ever seen. Everything was done on paper, and I had to convince people that computers could be worth something in the hospital, that they could earn their keep, sort of thing. It didn't have a fancy name like digital health. It had a name like computers in the hospital. I wrote databases and spreadsheets and all kinds of things to do lots of work that used to take my predecessor about 40 hours every 2 weeks to get done. And I wrote a bunch of stuff to make it all go away. So it was all done at the click of a button. That was a long time ago. That was 1998. The data era moved on, and full-blown electronic patient records, as we call them outside of the States, and electronic health records, as we call them in the States, they are now pervasive. They're everywhere. Every hospital in the States, half the hospitals in the UK, moving across Western Europe, and even into the developed world, where I've done some of my work in Pakistan and in Kenya. So now let's focus on that Oracle announcement. So Oracle they finally listen, right? So instead of clicking through 47 screens in order to find that thing you're looking for, you can now just say, show me today's labs. And poof, it brings it right up. It brings it up, probably the things that are associated with it, puts it all on the screen at the same time. It's a human-centered design, right? And that happens when you've got clinical people running the show instead of technology people. So that's why all of my advertisements, all of my writing, everything else is focused on clinical people, because we have something to give that none of the technical people do. We are the difference. Let's go on to the next announcement. Epic announced Cosmos AI, and it is trained on 16 billion patient encounters. So this is healthcare intelligence at an unprecedented scale. I mean, you'd think that the government, like CMS, would have done something like this, but no. This is Epic, and they need clinical wisdom to guide this thing in order to get it out. The Epic experience is not just for generating a cool dashboard that lets you figure out what might be happening out there in the world of your patients. No, it's designed to work right there with that patient at the point of care to tell you what's going on with them, what they actually need, and then to actually look forward in time for that patient based on those 16 billion encounters to figure out what happens next so that you, in that moment, can get ahead of it. It's fantastic. At least it has fantastic promise. I doubt when it's first rolled out, it's going to be that fantastic. But the difference between when it first comes out and when it is truly fantastic is us. It's people like you. So we've got to make our contributions to it. We've got to be the ones steering this bus. So every single one of these AI tools, I've only mentioned a couple. There's a lot more that's going on, but I've mentioned a couple of the heavy hitters. Every one of these AI tools needs clinical professionals involved to design, implement, test, optimize. And companies are desperate for people who understand the reality of healthcare delivery, because you're going to stop them from making a multi-million-dollar error. They're going to create something stupid. You're going to be able to say that it's stupid, why it's stupid, how to fix it. It's a big place for you to make your impact into this future of healthcare that we're on the dawn of right now. Oracle's voice interface, that wouldn't exist except for the last 30 years. Clinical people have been saying, we need to stop clicking and start caring, right? You've turned us into data clerks, and we want to do the job of actually delivering clinical care. Epic's new tools like Art, their little AI scribe, it takes notes and gets your clinical documentation ready, but it also goes and gets the stuff that you want it to go get, plus anything it thinks is also interesting, perhaps that the patient has mentioned ahead of time that they're interested in discussing, and things that are associated with it from that big Cosmos data set that can impact your decision making right now. And some of that information will come from another one of their AI tools, Emmy, which is just for patient assistance. So that Emmy talks to the patient before the visit and says, here's what we're going to talk about today. What do you have that we need to talk about? And adds that to the visit agenda. And then on the back end, we've all got to get paid for stuff, right? So Epic has another tool, cleverly named Penny, which does all of the billing. Converts all of that documentation into billable stuff, sends it out, follows up, makes sure that everything gets paid. And those three major AI tools are designed to work together. It's an exciting time. Yeah, it's an exciting time. But there is a gap. Tech companies can build these amazing AIs, but they can't replicate your understanding of what it's actually like to work a 12-hour shift or explain complex information to a patient who's scared, right? Can provide the patient, but a patient who's not in the right mental mindset, they can't handle that information, and that takes a human touch. So right now, what I'm seeing in the marketplace is that waiting even 6 months could mean missing this boat. Oracle is launching an ambulatory version of what I just described earlier, the voice first, the AI first. They're launching that now. And they're going to move it from there into acute care, into proper hospitals next year, 2026. And they need clinical project managers, implementation specialists, trainers, analysts now to make this a successful rollout. Epic's rollout timeline for AI features, it starts now and goes through 2026. Every healthcare system using Epic needs clinical champions to guide through this transformation. They recently published an article on LinkedIn that said the biggest barrier for getting this AI stuff into hospitals is actually the people. So managing the project, managing those nephrologists who are unhappy with it for some reason, that's the biggest barrier. That's something that's natural for people like us, for people like you. It's just something that you can roll into and do that work and make a huge contribution. And don't forget, a lot of this work is remote. So while your colleagues are still doing mandatory overtime, you could be working from home, helping to design the whole future of healthcare. So let's look at some of the specific opportunities and career paths here. There's clinical AI implementation specialist, helping hospitals deploy these new AI tools from both Oracle and Epic. And I said deploy. Don't think that I'm talking about somebody who knows how to write the code to make all of this stuff work. This is like installing Microsoft Word and teaching somebody how to use it. You never wrote the code that makes Microsoft Word work, and you never need to, right? That's some tech guy's job. Once it's in, we need trainers. We need lots of trainers. We need clinical AI implementation project trainers. So these are the ones who are going to teach clinicians how to operate in this voice-first interface environment and how to use their AI assistants safely and effectively. I don't know about you, but the thought of using these AI assistants for real patient care is a little frightening. I'm not sure that I trust them just yet. That distrust is common. Everyone has it. How do we get over that? How do we get the best out of it? Well, we put clinical people in charge of it, ones who know the downside of actually getting it wrong. Before it ever makes it out to the market, they need clinical product managers working directly with the places like Oracle, Epic, probably Meditech soon. They can't let this go unanswered, right? And they need those tools optimized before they ever leave and go out into the real world where they can actually do some work or some harm, depending on how they're designed. They're going to need data analysts. So if you're more techie and more geeky, places like Epic's Cosmos, using AI to do data analysis to figure out, hey, all of the people who live in this geographic area are all having this lab result. I wonder if there's something wrong with the water. You'll have clinical thoughts that technical people never would. And because of that, instead of helping one patient at a time, you're now designing systems that can actually help millions. It's a very fulfilling way to spend your clinical career. I found it very fulfilling. I was afraid at first that leaving the bedside, leaving what I thought was real care, was going to be sort of a chicken out, but no. I've made differences at lots of places that have affected millions of people, and I can feel good about that. So clinical people are uniquely positioned. You understand that healthcare isn't just about data and algorithms. It's about a human connection, trust, and the complexity of real medical situations. In Oracle, their voice-first interface works because it was designed by people who understand that clinicians need their hands free and their eyes on the patients, not on the computers. And other companies like Oracle and Epic, they need people who can translate between the technical world, which is now exploding with new possibilities, and the clinical world, which has some real consequences for getting it wrong. Patient safety is first and foremost in your mind. It's tattooed on your bones, most likely. But non-technical people have to be taught that and then reminded of it. They have to be herded through this process. They know that they can't be trusted with it, and they look at you. They look to you to know if they're getting it right. So Here's a little reality check. 6 months from now, these roles are still going to exist, but they're going to be filled by clinical professionals who act now, who make this change now. And there is an advantage to being some of the first movers here. The people who transition into digital health during this transformation will become the senior leaders and subject matter experts of tomorrow. Um, so let's look at the blog that I put out this week. I know blogs are kind of boring, but I couldn't help but notice how much my blog actually coincided with the news about the healthcare transformation. It's an amazing coincidence, and it tells me that things are actually they're coming together. Things are starting to click together. We're gaining speed. We're gaining momentum. The train is about to leave the station, right? So. When I was making this change, my family, my friends, they all told me I was crazy for going into digital health, because why would you ever leave a sure job that pays well like nursing? And I had to explain to them, I'm not leaving nursing. I'm doing something else within it, and it pays better, and it's reliable. They just couldn't get it. But I've been able to find fulfillment in it, while my former colleagues were still dealing with burnout, night shifts, and all the normal stuff that goes along with being a bedside clinician. And this allows me to serve both the patients and the providers. So the nurses and doctors and therapists and everybody else that I was working with, where we all had the same complaints, I get to be the guy who addresses those complaints. I get to fix it. So I know what some of you are thinking, especially if you haven't been on here before. That all sounds great, Rod. It sounds like pie in the sky technical stuff. Yeah, it is kind of, and you don't need to have technical skills in order to overcome it. You can learn those technical skills, and learning those technical skills is easier than learning how to interpret blood gases. So if you are already clinical, I know that you're intelligent enough to learn the puny technical skills that you need to overcome these kinds of problems. The whole point of that Oracle and their new EHR is designed to be intuitive. They need clinical people to test it to make sure it actually works, not the coders. We can get coders anywhere, and AI is replacing the coders faster than it's replacing other industries. So don't worry about the technical. You'll learn it. It's not going to be a big deal. And what if you're not ready? What if you're not ready to make this change right now? Well, these companies are implementing these AI tools, and they will train you on the technical aspects. But the problem that they face is they can't train someone who isn't clinical to get them up to 10 years worth of experience of, having worked clinically. So the only way through is to train clinical people with a little bit of technical stuff. That's where your opportunity exists. So these transformations, they happen over months and years, not days. So there's time to learn. There's time to act. This isn't one of those infomercials where you have to call the 800 number and give away a credit card or something. No. The time is now. If you wait half a year, the time's going to get harder. If you wait a year, it'll be even harder than that. And then we're going to be on the digital health, AI healthcare train, all of us, whether we like it or not. So if you're ready to be a part of that, if you're ready to be a part of building those healthcare systems now, the way that I've talked about, and you've always wanted to do this instead of just surviving in your clinical job, you want to get out there and thrive and make a real difference, make more money, achieve some sort of like control over your schedule, that sort of thing, then this might be the time for you to DM me and get in touch. I've got a digital health career transformation guide on my website. If you go there and wait about 30 seconds, 60 seconds, it'll pop up and then it'll email you a link and you'll get some of the basics. It'll tell you some of those jobs, some of the things you need to do, some of the things you can do on your own. I'm a coach and I help people do this. But let's be clear, I didn't have a coach when I did this. It took me about 5 years in my career to sort of really find my feet, start making a lot of money and doing the things that I found most important. It doesn't need to take that long. it can be much quicker. One of my favorite clients is starting her new job in 10 days. She was a bedside nurse here in the UK. She has fired her boss, given herself a raise. She's more than doubled the salary of a bedside nurse. She'll be working remotely. It's a new day and a new time for her because she started acting about 6 months ago. So it's a great time. It's a great opportunity. So finally, the train is pulling into the station right now. You need to decide if you're getting on. If you don't decide if you're getting on, the next train is coming and you'll be pushed on because we're not going to escape this dawn of the AI era. It's coming for us. So I can see the chat on Instagram. I cannot see the chat on the other channels because I haven't figured out how to do that yet. But please, if you want to get in touch with me directly, just DM me. I'll respond back to you personally. Right now, my DMs are getting a little high, a little full, kind of taking lots and lots of time. I may have to go with a different approach so that I can weed out people who are not ready, help people figure out if it's really for them in more of a question and answer scenario instead of direct messages. If you have any questions and you're comfortable putting them in the chat, go ahead and do that. If you have questions and you're not comfortable putting them in the chat, then please DM me directly and we'll have a private direct message conversation. That is never enough to decide if this will be right for you. If it is possibly right for you, we'll set up a Zoom call and we'll help figure this out. If I think that it's right for you, I'll make you an offer of how I can coach you and what I can do for you. I don't make offers to everyone that I get on the phone with because it's just not right. And because of digital health, I'm financially secure enough that I don't need to worry about every little thing that comes along, and I can focus on working with the right people to do the good things and do my part for helping healthcare move forward. So I hope this has been useful for you tonight, and I will be back on again next Thursday. I can't promise that the news is going to be that exciting next Thursday, but I'll be here and I'll be talking about the realities, the opportunities, those kinds of things. Look forward to seeing everyone next week and have a good night. It's dinner time here in England.